The battle over health care is heating up, and front and center in the debate is one of our congressmen, Joe Courtney from the 2nd District, who joins us now. Congressman Courtney, nice to see you back here again.
Yep.
So you had to work last weekend?
We did.
Tell us how this all went down, because a lot of people were saying, oh, it was sneaked in on a Saturday.
No way. I mean, there, in my opinion, has never been a more transparent, vigorously debated, discussed topic than the legislation that we've been working on really for the last 9 months. I sit on one of the committees that's dealt with it. We had it up and posted back in July. Lots of town hall meetings, telephone town halls, web chats. And yes, there was a revised version of the bill which was offered a week before we voted, which was probably 85% the same. My office culled out the pieces that had changed and again made that available to constituents who again are passionate about this topic. And again, it was a very vigorous debate, which I've run into so many people who spent Saturday watching C-SPAN, which was kind of hilarious. But I really think it's going to go down as a historic day. Whether what the end game is and the final outcome is still a little unclear, but this is a high watermark for comprehensive health care reform to get actually passed in the House.
What does your gut tell you? Is the form that you passed this past weekend going to make it? I mean, it doesn't look like it's going to survive the Senate.
I think large pieces of it are going to make it. I mean, certainly, you know better than anyone, there's always a conference process, and that's going to cause changes. But the guts of it, which is really about trying to offer people what members of Congress and federal employees get, which is a menu of choices, which, every state has a different kind of plan. Connecticut, Aetna, Blue Cross is offered to members of Congress and to federal employees. That's really the structure that we're trying to create, an equivalent system of stable, affordable health care, again, that members of Congress. As you know, I don't take the federal plan. I promised my district that I wouldn't take it until we created a system that was equivalent for all Americans, and I think we're getting closer to that day.
There's a lot of talk out there that Democrats will have to cut Medicare to get this through, and a lot of people, they're concerned about it, particularly senior citizens. And what do you say to them? Will it be cut?
It will be adjusted, as it has many times in the past. In 1997, a Republican Congress with a Democratic president passed the Balanced Budget Amendment that actually reduced Medicare expenditures by 12% over the following 10 years. The bill that we're passing has a similar type of adjustment. It's a 3% reduction. No benefits, no entitlements in terms of hip surgeries or nursing home 100 days are being affected in terms of any changes that are taking place. But again, this is a program which over the next 10 years, as a nation, we're going to spend $6.3 trillion for Medicare. And so within that huge reservoir of money, we are making some adjustments based on very sound advice about different services that we're overpaying.
What do you say to the small business owner who thinks he's healthy and doesn't want to have health care and now he's going to have to pay for it or go to prison? Is that correct?
No, actually,
or be fined?
Well, the small businesses, number one, are exempt with payroll $500,000 or less in terms of having to offer a benefit for their employees. There is going to be an individual requirement that Americans, like their car insurance, are going to be required, except in cases of real hardship. There will be a safety valve for people that can demonstrate real hardship or religious conscientious objection. But what we're doing, again, just like members of Congress, is creating a structure where people will be able to go in, get a menu of choices. If they can't afford it, they'll be eligible for subsidies up to 400% of the poverty level, tax credits for small businesses. So I think, having been a former small employer and dealt with these huge increases year in and year out, that this is actually going to be a better system for small businesses.
Let's talk a little bit about Senator Joe Lieberman. He said that he was going to block, any movement toward a public option. What did you think when you first heard that?
I think it's very unfortunate. I mean, there's, been a lot of news today about the Quinnipiac poll. One of the questions that I did actually look at was question number 64, which asked people, do you support allowing a government insurance program to be an option that you can buy? And 56% of Connecticut said yes to that question. Now, let me say this, Joe, if Joe doesn't support that and he doesn't want to vote for it, that's fine. I understand that. There's times when public officials have to make an act of conscience. But what he's talking about is not his own vote. It's about whether or not we're going to allow allow even an up or down vote in terms of this issue. And I think that's very unfortunate if he's sending out messages that he's not going to allow this incredible moment of history to move forward, at least to a vote.
The poll also asked if he was more of a Republican or more of a Democrat, and the people polled say he's more of a Republican. Do you agree?
Certainly, on a lot of issues, he's strayed from, I guess, what you would call the sort of party line. So have I a couple times, and I think on balance, he probably still, would show more votes in accord with the rest of his caucus. Certainly, he's a member of the caucus, and he's a chairman of a major committee. But again, we're talking about an issue right now which has, been waiting for decades to get really considered, and I hope that we're not going to see a filibuster be used as a device to block a vote. That's what happened with the civil rights laws for year in and year out before we finally got passage in the early 1960s, and I really feel we're at a similar moment.
You were here in the district this week working on with the National Guard. What is that about?
The National Guard, like all of our military personnel, were subject to a rule called stop loss during the Iraq and Afghanistan deployments, which was really, I think, a backdoor draft. Folks who had their term of enlistment suddenly found that they were called back into duty involuntarily. About 185,000 military personnel in the different branches, about 450 here in Connecticut at the National Guard. Just recently, myself and a number of others co-sponsored legislation which was picked up in the defense spending bill, creates a new benefit. If you have been a stop-loss veteran, you are now entitled to a $500 payment for every month that you were called back into service involuntarily. We had a young man in my office who was an intern. He was stop-lossed for 12 months in the middle of his deployment in Iraq, and now he'll be eligible for a $6,000 payment under this program. People should contact their military branch. They're not going to come out looking for you on it. You've got to apply between now and October 2010, and that was the purpose of today's press conference with General Martin and Attorney General Blumenthal, to get the word out that people have really got to get out there and request this benefit, which they completely deserve.
And this is not part of the Troops for Teachers. This is different, right? Troops to Teachers?
That's right. That's a new bill that I co-sponsored, believe it or not, with Senator John McCain, which is to basically enhance an existing program that incentivizes military personnel to go into teaching professions. Unfortunately, not many Iraq and Afghanistan veterans have been able to access it because of some of the rules. We're going to expand the universe and get these great Americans in classrooms. I mean, you can't ask for a better role model than folks who've worn the uniform of this country. They know all about teamwork and discipline, and we're real excited. We're picking up lots of support. The American Legion, American Federation of Teachers, which is kind of unlikely allies, have joined together, and we're hoping to get action on this bill, certainly as part of the education and reauthorization bill, which is coming up pretty soon, or as a freestanding measure.
Running for Congress is pretty much a perpetual thing. As soon as you get sworn in, you have to start thinking about, the next 2-year term. What are your official plans for 2010? At
this point, I intend to be a candidate. It seems like an eternity from now, just like the last election did. But I'm still excited about the work that I'm doing. I think I represent just a great part of Connecticut. I really enjoy it. And but as I said, this is a business where things can change pretty quickly, and I don't foresee not being a candidate, but at this point that certainly looks like it's the plan.
Senator Dodd's poll numbers are low. He's been suffering from low poll numbers all year long. Do you think that he will be a drag on Democrats in the state next year?
I think it's too soon to say really anything about, and I'm somebody who went through the closest election in recent memory, excuse me, in 2006, won by 83 votes. I was down in double digits in September in that race. So things can change quickly. He is completely engaged. He's back home, as you know, every weekend now. He's out there listening to people, and I think he knows he's what he's got to do. And I think you're going to see an experienced, accomplished campaigner and senator out there really turning people around over the next 11 months.
Congressman Joe Courtney from the 2nd District. Nice to see you back here again, Congressman.
Thanks.
We'll have you on again.